Good morning, friends. I'm Dr. Sandeep. Welcome all of you for our homeopathic channel, Homeopath YouTube channel. So today's subject is what are the blocks in the curing process of homeopathic treatment. Usually we come across so many blocks. I mean to say, whenever a physician totally takes the case into consideration and he gives a indicated individualistic medicine for a patient, so within a week or within 15 days a patient returns and tell that there is no improvement or there is no changes in his symptomatology. In this condition we must look into what is blocking the indicated medicine. So there are few things a homeopathic physician must be clear of his understanding in the process of cure. So one is a antidote which is administered daily by the patient unknowingly will block the medicinal effect on the patient. So this is the primary thing every homeopathic physician should observe. Next, the environment. So in which environment the patient is residing. So in our materia medica and Organon of medicine, it is clearly stated that a maintaining cause will always have an obstruction in the effect of the remedy. So is there a maintaining cause which the patient is not aware of and he is just taking the medicine in spite of this maintaining cause. So as you know, maintaining cause, it is his habits and the surrounding environment. If he is smoking, if he is taking alcohol, if he is consuming coffee, if he is very much exposed to stimulants, so this will be a block in the process of effect of the medicine and the process of cure. So another one is the environment. So wherever he is residing, if the environment is very damp, very much cold, in these conditions the medicine will not have any access to perform the cure. So this is one of the important factor homeopathic physician should understand. Another thing which homeopathic physician should understand is the food habits. Is the patient is consuming junk food or a particular type of food which he is not accustomed to, which he is very sensitive to. In that condition also our homeopathic medicines will not have an access to cure the patient and the disease in total. So a keen homeopathic physician should observe in all the levels where the medicine is being obstructed from performing its action. So these are all the things which usually everybody will understand and they will take care. But one very minute thing which usually all the physicians miss is a strong smelling perfumes, a strong smelling spicious things which the patient is exposed daily. In these conditions also, the process of cure or the medicine will not act on the body mind system. Strong perfumes and strong astringent substances if the patient is exposed daily. So this is all about knowing what are the obstacles in the action of the medicines. And another thing, main important thing is miasmatic blocks. This is very important, friends. So miasmatic block is not being understood by many homeopathic physicians. Due to that reason, the medicine is not at all active. So Hahnemann researched for 12 years, as we know, that a indicated medicine should also have the miasmatic background to reach the totality and perform its action on the substance or the homeopathic patient. So, if the underlying miasm is blocking the process of cure, first we must address those blocks, then the proper indicated individualistic totalitarian medicine will start acting on the patients. If a block is of soric origin, so no sword from sorinum you can use. If it is a block of psychotic tint, tuja can be used, madorinum can be used. If it is a block of miasm of syphilitic origin, you can use syphilinum in the indicated potencies. So these blocks will not allow your indicated similimum medicine to cure the patient. For example, one patient of mine, whenever I give Merxol, he has a wonderful effect and he will be very ameliorated by the symptomatology. But a total cure of the patient is not happening. I was thinking, what was the cause for not going into curative state in the patient? He is not going to curative state of a curating process is not being triggered in this patient because there is a miasmatic block in him. In spite of indicating a symptom similarity medicine, he needs a miasmatic block clearance first. So I gave syphilinum in a required potency and waited for 2 weeks. So the symptomatology started improving and the patient started noticing a very much good improvement in his mind body state and his lifestyle. So this is one example, friends. So if there is a miasmatic block and we are struggling to give the symptomatological totalitarian medicine, it is very difficult to cure the patient. Hahnemannian homeopath, what we call as, or classical homeopathy, what we call as, single individualistic indicated medicine will have a greater access to cure the patient when there are no blocks, there are no hurdles in the process of cure. So we must see to it that is there any block in the patients. Usually nowadays the patients are taking so many medicines and they are insensitive to so many medicines. So that is also one of the miasmatic block in the patient developed by the patient himself. So one is food, another is beverages, another is lifestyle, environment, and finally a miasmatic block. We must observe and treat the patient accordingly. So this is all about hurdles or blocks in the treatment of homeopathic patient. So today I talked about what are the blocks and what are the hurdles in the treatment of homeopathic patient. So if you like this video, please like, share and subscribe friends, and please hype the video so that so many people who require this can be seen this video. I also do videos on the practical application of homeopathy and how effective is classical homeopathy and how it turns the total viewpoint of the patient when he gets cured. So this is all today friends. If you like this video, please like, share and subscribe. Hype the video. In next video we'll meet again. Thank you. Take care.